Good morning, good afternoon, assalamu alaikum. I belong to Bukhari Medical University. This is a place where I work. It's called Orofacial Professionals. It's a place for house surgeons and oral physicians. There's a quick peek through the practice and the premises. Ladies and gentlemen, my today's talk is miswak, a lost tradition. Why teeth are so important? Because all social activities centered around the food, uh, and in our culture, food is very important. Feed the patient, not the tooth, is the slogan we tell all the time to our patients as well as our students. The Professor Kalmish suggested the goal of modern dentistry is to restore normal control, function, comfort, aesthetics. And on the top is health, which is very important. We need to understand the risk factors of diseases because we practically cannot treat all diseases. We need to work towards prevention of the human ailment. The major complaints patient presented in the practice is tooth decay, mobility, bad breath, swelling, bleeding, discolored teeth, missing teeth. But at the same time, patient also present with their body ailments. So body mark connection is the slogan. I like to share this through the presentation. These three pathways link. I found a great slide. I like to spend a minute because the bacteria stay in the mouth. They actually party and metastasize from the mouth to the body. So these three ways and pathophysiology, either they move themselves or their toxins move and metastasize in the form of diffusible proteins or insoluble antigen. So they enter from the mouth to the bloodstream and cause inflammatory reaction in the body and causes systemic inflammation. WHO estimated suggests the peritonitis is found quite phenomenal in the world, and it increased the overall burden of the diseases. According to the U.S. Centers of Disease Control and Prevention, periodontal disease is considered to be the worldwide pandemic, causing disability, speech impairment, low self-esteem, and reduced quality of life. Uh, this is a slide I like to emphasize that during period conditions, locally produced pro-inflammatory mediators, interleukin 1, 6, TNF, PGE2, they actually move into systemic circulation and subsequently exert effects on distant organs and increase or perpetuate inflammatory states. And if you see and compare the healthy individuals uh, between the periodontal patients, they have relatively higher white cell count and C-reactive protein produced by the liver. And not to mention misdiaphragmitis and uh, the smoking, the two factors, they destroy the periodontium drastically. So we're trying to relate the body mouth connection. The unhealthy mouth uh, has a linkage and association towards cardiovascular and respiratory diabetes and Alzheimer's disease. We need to, as all physicians and all scientists, need to work to make sure that the patient and our colleagues will understand what is the exact relation, because the low-grade inflammation is a known fact, evidence-based, and contribute to the following diseases. So in periodontitis, there's a low-grade inflammation, and these are the condition where you see the low-grade inflammation. So they are said as low-grade inflammation. The systemic low-grade inflammation factors seem to be influenced by the composition of microbiome, which changes as a consequence of periodontitis. The CRP plasma levels are higher in peri patients compared to periodontal healthy patients. Interleukin 6 levels are slightly higher. this was discussed earlier. So my slogan to the entire community is brush your teeth and save your life. So we are quite aware of the plague, that we need to clean the plague, but it's actually the fertile breeding ground for bacteria. Fizzy drinks also not to miss, because the consumption has improved drastically and they just destroy the bony architecture. And it's a known fact that fizzy drinks decrease the pH and decrease the bone matrix. The chewing habits in our part of the world, pan, prague, gutka, is very popular and is the cause of the oral cancer, the white lesions, and bad oral hygienes. This is simply the odontogenic infections because of the poor oral hygiene, and the people are not aware that oral hygiene is very important in order to maintain the oral as well as systemic health. This lady came in the second trimester, and she was not doing properly the oral hygiene instructions, not brushing properly. So for these, I would suggest to actually in our part of the world, Pakistan, to do miswak properly. Do the patient know why the dentures don't fit? Because bone loss in the mandible, and bone loss because there's no teeth. So we all have aim to have a sparkling smile. So let's come to the toothbrush, because toothbrush is very important. We need to tell the patient it helps to massage the gums, and it carries the toothpaste, gentrifies it, clean the food debris, and remove the dental plaque. However, correct angle brush is very, very important. Nonetheless, toothbrushing doing the wrong way it's also cause tooth abrasion, gingival recession, sensitivity, and tooth loss. Uh, it's rare in many parts of the world, in third world countries. So if you see the history of toothbrush, modern toothbrushes invented by William Eddy, and many parts of the world, the Greek Romans, Babylons, then modify them. We need to find out, also know that the toothbrush stay in the toilet, and lots of bugs, the virus and bacteria grows, and we exchange these bacteria between the family members, and use the same brush forever and never tend to change them. So my inclination is to instigate the use of miswak among healthcare professionals, because in contrast, toothbrush is used significantly reduce the amount of bacteria as suggested by many publications. The chewing stick also needs to be used properly to be effective in preventing dental diseases and promoting oral health. Low case prevalence is found in people who use chewing stick. It's also children who use chewing stick. There's a study in Zimbabwe has a fewer caries lesion. Gingival indices were significantly low. It was they found Sudanese population better than the toothbrush users. Only precaution you have to use it properly. It says in the weekly magazine American Dentist. The National Health Surveys suggest that in our part of the world, people do not brush teeth regularly, and what do you expect to keep the mouth clean? Although the global goals in 2020 says think globally and act locally, so we need to find out what works best in the local environment. Professor Muhammad Saeed Al-Jaridi says many times the toothbrush, toothpaste, in mechanical terms. After carrying out research, he found a substance which is in miswak kills germs and heals our mouth diseases. So these are patients who develop deficiencies by not maintaining oral health, and they develop anemias. Cividora persica, the bark, the pulp, as well as the whole miswak were very effective against various bacteria, staph mutans. The Cividoria and Cividorine is responsible for observed antibacterial and gum stimulating effects. Powerful saliva, the thiocyanate peroxidase system work against the bacteria, and this could prevent it if we could have used the miswak properly. The inhibitory effects on the level of certain bacteria in saliva is improved by use of miswak, as suggested by this journal. The WHO recommended the use of miswak 1986, and because it is proven fact that miswak leads better between the teeth and do not break regardless of the amount of pressure you apply, and do not damage the gums. It has many systemic, physiological, and local benefit. Biological effects in miswak is also evident from literature, that anti-settling activity of red blood cells, it has tumor inhibiting properties. The decoction of Salvadora persica has been used for treatment of splenomegaly, rheumatism tumors by Troboto in hypoglycemic effect of Salvadora persica. They also found in Moshti et al. Reported the silica, sulfur, vitamin C, and tannin found great amount in this small stick. Uh, these stains cannot be removed by a toothbrush. However, teeth whitens, so silica-based materials is brilliant with the tannic acid astringent capabilities to have the bleaching of the teeth, because it has the astringent effect on the mucous membrane, thus reducing the clinically detectable gingivitis. Aroma and stimulation of saliva also great features found on the miswak. It has carbonative antiseptic actions, volatile oils. Sodium bicarbonate has a mild abrasive effect as well. Calcium saturation of saliva inhibits demineralization, promotes remineralization of tooth enamel. Pseudo persica contains substance that possesses plaque inhibiting and antibacterial properties. The growth and acid production of these bacteria does inhibit it. Antimycotic activity is found in literature. Antifungal properties is very evident when tested with 10 aldehydes. The release of calcium ions and chlorides is significantly decreased in phosphate, and it inhibits the calculus formation in the use of miswak. The analgesic effect also found has very effective against thermal stimuli. Isobutyl extract exhibit the greatest activity. Streptococci were the most sensitive of the bacteria. Vancomycin resistant enterococcus, multi-drug resistant activity also found in against miswak. Bacteroid species were most sensitive to extract from selected African chewing sticks. Systemic effects suggest the positive effect on the immune system, anti-smoking effect. It has a deodorant effect. It absorbs the odor of the mouth. Surprisingly, antiplatelet effect IC550 values were defined as a final concentration that caused 50% inhibition. Zhang et al. 1997 has shown in one publication. Anti-conversion effect and sedative effects also found. Generalized tonic-clonic scissors, that's protection against pantonyl tetrazole induced convulsion by increasing the latency period and diminishing the death rate. Amazingly, inhibitory effects of Sudan plant extract also found HIV replication and HIV proteases. So what I'm trying to say is, if plastic brush with nothing chemical constituent can prevent cavity, then think about miswak, which has the bitter oil in it. The only precaution, you have to use it properly. So that's the way you hold it in your hand. Let's see what the sunnah with regards to siwak. Literature says that the religious practice of miswak in Islam and association with quotation from Prophet Muhammad PBUH have been emphasized, and there's a very common theme in Sahih Muslim, Sahih Bukhari, where not for the fact that I did not want to make things too hard for my ummah, I would have commanded them to use the siwak every time of the prayer. So it's used before sleeping, after rising, before eating, after eating, and it says in all the religious scriptures. The pilu has been used tremendously in the old days, and let's see how to use miswak. The 20 centimeter length for adults and 15 centimeter for children is good enough. An excessively long stick may result in trauma, so avoid long stick. Diameter should not be more than 1 centimeter. It should be freshly cut so that it is supple, easily chewed, and still rich in active and constituent. These fibers should be clipped off every 24 hours. That's very important. People use it forever. When they make the miswak, and they keep in their pocket and use it forever. You got to make show that you use, you make the head, you make the brush every day and use the fresh brush every day. So tongue is a common cleanse by use of chewing sticks, and it's the best tool uh, to use the tongue, and because most bacteria they cause halitosis, and this stays in the tongue as well. And the miswak brush is amazingly cleans the dorsum of the tongue, and that's how use it. So when to use it, 5 minutes of complete devotion to its function is deemed sufficient to ensure good cleaning. Thus resulting smooth filling of the teeth with the tongue gives the critical measures of the efficiency and effectiveness of the chewing stick. But make sure whatever stick you use should not be poisonous, should not cause any bleeding, and you should not use it on other people certainly. When you prepare it, that the stick is chewed and tapered at one end until it becomes frayed to the brush and left in the mouth. The miswak will stimulate the saliva with aroma. It will be better cleaning effect. Miswak will be effective ease the pang of death. Is found on one of the scriptures. Prophet Muhammad used it before he left this world. Allah knows the best. I found it interesting that it can grow in the soil of dry nature, saline nature, of any kind of the soil. It grows even dry environment. So we should make sure that we should grow this miswak tree in our country. In conclusion and recommendation, miswak can be a good alternative to the toothbrush, and it is inexpensive and readily available. Contains many medicinal properties and is available in most rural areas of poor countries. It does not need expertise or any extra resources to manufacture it. That it is recommended as an important and effective tool for oral hygiene. Dentists who practice in areas where chewing sticks are commonly used should realize that the patient might need specific instructions on proper use to use the chewing stick. So I put it in my clinic, and this is free of cost for all my patients and clients. We need to work towards decrease the burden of oral diseases, as says in WHO document 2018. They're still working in 2022 because dental treatment is costly, averaging 5% of total health care. So prevention is the essence of all treatment. Dentist in the modern world is the oral physician. So with these viewers, I thank you all. So give people a reason to smile, Pakistan and Nabad.